Hello, our dear viewers. My name is Agatha, the host, Empower the Girl Child. Sit with Taata is your show, and don't forget that it's only and only powered by Front Desk Pictures. Today I am here with this doctor. He's here to teach us about our dental health. He will advise us on how to keep our teeth clean and much more. Doctor, say hi to the viewers.
Hello and I welcome you all. My name is Dr. Hassan. I'm a dental surgeon. I work with Mars Dental Surgery here in Kasuri, and I'm honored to be part of this show today, and will be highlighted more of what we are going to learn, but it's a fruitful service. Thank you.
You're most welcome to this show.
Thank you.
Sit with Taata is not a show where I'll only be sitting with my father, but I'll be bringing other important people now, like teachers, farmers, carpenters, members of the parliament, maybe the president. They'll be teaching you about other important things. Are you ready to learn with us? My name is Agatha, the host, Empower the Girl Child. Doctor.
Yes, please.
I have a few questions here, but they are not from me. They are from our dear viewers. So the first thing I wanted to ask you that why is it important for us to go for dental checkups? Why?
Okay, the major reason uh, for having regular dental checkups, it's mainly it's more beneficial to the patient, and the main reason as to why it's because it's preventative. Normally, a tooth has certain layers, and certain layers behave differently when infected. Like when you have a cavity at the start, at the enamel, when you have a cavity, it might be there when it's not painful, but the more it progresses, it will cause discomfort. But if you are doing the regular dental checkups, it will be able to prevent future outcomes that may happen, like a cavity ending up into an abscess, which is not good, and it can cause pain that's really unbearable. So if you come to a dental visit as early as possible, the recommended dental visits, at least you have one dental visit every 6 months. It will cut you the costs of treatment, because when you see something at any early stage, the cost of treatment will be minimal. But if you keep on taking your time to go to see a doctor, I'll go when there is pain. Like now in our country, most patients come here only when they have pain. Without pain, someone can live with decayed teeth as much as they want. But if we do routine dental checkups, pain will be avoided. The other circumstances like abscesses, all those things can be avoided. Even if it's the case of like a tumor, because even in dental we have tumors, cancers. If you see it as early as possible, better outcomes of treatment. But for you as an individual, you may see it as something that's normal. But if you have the regular dental checkups, you see it early, diagnose it early, treat it early, better outcomes.
So it's better for me if I came for dental checkup this month, the next month I can still come back.
The right thing to do is every 6 months you have a routine dental checkup. So for your first dental visit, I will assess, then I will tell you for your personal, like specifically you as a person, I will inform you that for your case you may need to do every 3 months. For your case you may need to do 1 month. So it will be advised from me, but routinely, generally it's going to be 6 months, every 6 months. But specifically depending on your condition, it may vary.
Now I get you, doctor. What should we expect when we go for dental checkups?
What we should expect, first of all, it's number one, a warm welcome. We know in our community people fear coming for the dental clinics, reasons due to various reasons, which at times may be something I heard the other person say, like pain, what, all those things. Those are some things that people fear. So if you give people a warm welcome, you come, we are going to establish rapport, small communication, such that we get to know each other. Then after doing that, we are going to do, you're going to tell us about any problem you're having. Like, are you having any dental issue? Is there like any challenge you're having? We have that first talk. You tell us what's happening, any problem. Then after us knowing, listening to you, we get our tools, we examine full mouth exam. Then after doing the full mouth exam, where necessary, we may do x-rays or we may not. Then after that, we can recommend if treatment is needed or not.
Oh, thank you so much, doctor. You know, doctor, we need good teeth, healthy teeth, but we also need good sound.
Yeah.
So our dear viewers, if you have any function, any wedding party, any birthday party, just contact Gabon Sounds for good sound. Thank you. Doctor, I have this question also. You as a professional doctor, which toothpaste would you recommend for people to use?
Actually, that's a question you get a lot of times as doctors. But like I said before, after having the regular dental checkups, toothpastes vary in what is contained in the toothpastes. Locally, most people know the regular brands, which we all know: Colgate, White Dent, Daily Dent, ABCD, each and everything. And all brands that we have on market, but there are brands which people don't know. Like, for instance, we have toothpaste that's specifically going to help people with sensitivity. We have toothpaste that's specifically going to help people with periodontitis, bleeding gums. We have toothpaste that's going to help those who need whitening services. So different types of toothpaste are on market, but we can't choose a specific brand. But when you come for a checkup, a dental checkup, we can tell you that for your case, this toothpaste will be the best for you, because different people, but if your teeth are clean, any toothpaste would be fine for you, because the nutrients in toothpaste, they're the ones we are going to use for cleaning. And the most important thing is actually not only the toothpaste, but how you brush and how you use the toothpaste also matters. So part of the regular dental checkups, after seeing your problem, we shall tell you that maybe your brushing habits are the one leading to this. So you may be having the best toothpaste, but then your brushing habits. So all those things come with checkup. So each person may have a different toothpaste which we recommend. So it only comes after a checkup. I hope I've answered it well.
Yeah, thank you so much. As there are some people who brush every afternoon, but why is that yellowish color always? Why does it appear on that thing? Like after brushing every meal, you brush, but still that yellowish color still comes on your teeth. Why?
Okay, that question has two parts. It's about the color and then the brushing. Number one, the brushing, I don't know, some people maybe have a lot of time to be brushing after every meal, because if you eat like breakfast, lunch, then in the evening hours you have some snacks, then you eat in the evening supper, that means you're going to be brushing 4 times a day or even more. I think that's a lot of times to be brushing all the time. And in the mouth, we have saliva. Saliva is one of the things that keeps our mouth healthy. So the best time for brushing, actually, we divide these times of brushing into two. You either brush for yourself or you brush for others. Brushing for yourself is brushing at night before going to sleep. Then brushing for others is brushing what? Brushing for others is when you brush in the morning. When you brush before going to sleep, you're cleaning anything that's in your mouth. In the morning, you're cleaning to remove that bad smell that comes when we have spent a lot of time on talking. Then, back to the issue of the color of the teeth. Different people have different colors of teeth. We have variations starting from pure white tending to a color of brown. So different people will have different colors of teeth. So those different shades are what determine what your color is going to be. So it can, even if you're brushing, and you're still doing that, still your color will change. Then as well, it comes back to how people brush. So that's one of the things that's covered in the regular dental visits. We come, we teach you how you're supposed to brush. Because not that everyone knows how to brush. I may be just coming with my toothbrush, quack, 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 very fast, and I'm done. That color won't go away. And then there are different stains that are on our mouth that came at a certain period where we were reluctant on brushing. Yeah? And when those stains came, for you, you thought when you brush, 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 the stains will go away. But those things don't go away unless you come for dental treatment or management. Thank you.
So how can we treat it? Because if it's caused by it has many reasons why it comes. So how can we treat it? Are there many methods we can use to treat it?
Actually, dental treatment doesn't range from the common things people know, doing cement, root canal. Dental treatment is broad. It's a broad spectrum of treatment. So anything that you can think about that's in the mouth, specifically your mouth, or even some parts of the face, because even the bones in the mouth determine the shape of your face. Everything can be managed by when you go for a dental treatment specifically, because this is a specialized field of medicine. So it's just we focus mainly on the mouth. So even if it's change of color, it can be managed. Even if it's bad smell, can be treated. Even if it's anything that making your cosmetics or aesthetics not to look good, can still be managed.
I get you. Our dear viewers, are you getting it? Um, do you have any function? Do you have any wedding party? Just contact the Trisha Cakes for good cakes. I swear I will never regret. Doctor, um, there is this thing that I've been asking myself for so long, but I couldn't ask because I never had a doctor to ask. But you're here. Um, talk about the bad smell. I mean the bad breath. So I see always people who brush, but still that bad breath comes. Why does it, and how can we treat it?
Okay, thank you. So normally, in the mouth itself, we have normal flora. Normal flora, I mean like the microbes, the bacteria, fungi, anything. Yeah, we have normal. But once the normal exceeds the required number, we are going to start producing a certain gas called hydrogen sulfide, and then that gas is going to cause a bad smell in your mouth. Now, what normally happens, there are different causes of a bad breath. You can have, there are people who come and they have a lot of calitulas, people who have a lot of cavities, people who have abscesses that they didn't recognize. So sometimes bad breath is a reminder to you that you need to, that there is a problem in your mouth that needs to be managed. So it can be a good or bad thing, but in most cases, when you see its good part, because this is an alarm to you. And normally people are offended but that when you tell them that you have a bad breath, because they would think for them they are brushing well, but then even it's not just about brushing, because like I told you before, most people actually don't know how to brush.
Yeah.
Most people brush only the front part of the mouth, but of the teeth. But then we have the behind part, we have the middle part of the teeth, we have the upper part of the tooth. All those surfaces need to be cleaned when brushing. So if you're not going to clean those parts, we shall have calculus deposits there, and then they end up causing that foul smell, the one we refer to as halitosis. And when you have that, you may not be the one to recognize it. Maybe a small hint. I would advise our viewers, if someone tells you that you have a bad breath, it's not necessarily an offense. Because if you come to me as a doctor, I'll tell you your breath is not good.
Yeah.
And in my clinical picture, I'm telling it to you because I want it to be managed. So think of it as your friend telling you that you have a bad breath. This person wants you to go and seek management, yeah, which is in various ways, because we can't list all the treatment modalities we have on just a show. So there are various ways. So it's not just brushing that will erase away the bad breath. though sometimes you can brush and then it goes. Then there are some cases where it's caused by the different hormones, like you can have it in pregnant women, hormones causing the bad breath, so variations occur.
Oh, doctor, I have learned so much. I didn't even know some, like why bad breath is caused in some people, but I've learned so much today. So, doctor, waliwo omulwadde yenna eyali akusumbuyeeko. Our dear viewers, if you have any function, any party, any wedding party or anything, or you are at home, you can contact Wiki Juice for good juice. I swear you will never regret. Doctor, I also wanted to ask you this last question. It's waliwo omulwadde yenna eyali akusumbuyeeko ng'oli mumujjanjaba ng'akusumbuwa, and how was it?
Actually, ebiseera ebisinga abalwadde abatusumbuwa obuzibu bubeera buviira kumukuba mpiso.
Kumukuba mpiso?
Ye watandikira, because it's the first step of treatment. Ebiseera ebisinga any patient ajja nga ali mu bulumi, and we can't do treatment ng'omuntu ali mu bulumi. So tubeera twetaaga tumusannyalaze okuba empiso, then obulumi buggweewo olyoke omukoleko. Naye kati obuzibu bwe tusanga abantu abasinga ajja kujja nti empiso biki, naye ng'ate n'empiso gy'atya yegenda omuyambako okubeera nga atereera. So ebiseera ebisinga abalwadde abasinga otusumbuwa akusumbuwa nga atidde empiso, which is natural, naye engeri gye twafunamuko engeri yokigonzaamuko, twafunako tukiyita topical anesthesia. Omuntu obeerako akantu k'omulabingako oba kasupre k'omukubako okwo wogenda okuba empiso, so neyingira nga tejja muluma. So wakirabako okwo kutya ne kuvaayo. Then ekintu ekyakyo tusinga okufuna ng'engeri gye tuli nti n'omusawo oli muto, ate abantu bamanyira abasawo nga bakadde. Ebiseera ebisinga oli ajja kubeera takikiririza ono ye musawo, naye ng'ate it all comes with education. Bw'osoma mangu era ojja kubeera musawo mangu, bw'olwawo osoma ojja kubeera musawo ng'oli muki mukadde. Naye nga okusumbuwa kusingayo ku byonna kuviira ku mpiso, si bujjanjabi wabula mpiso yesinga oleeta obuzibu mu mannyo, naye twakisalidde amagezi era wojja n'otukolako wano eno ovaawo nga tokyabirabanga buzibu, kibeera kiri okay.
Oh, our dear viewers, for quality videos and photos, just contact the front desk pictures. I swear you will not regret. Doctor, say your last words as we end the show.
My last words, if you want to save your wallet, you want to save your money, the best thing for you that I recommend for you, do regular dental checkups. If you haven't done any dental checkups in your life, you're not fine. Anything that seems unusual, go see a doctor, a dental surgeon. Anything that's happening in your mouth, go visit a dental surgeon, because you'll be helped and these things will be preventative. Delay will empty your wallet, because the more you delay for treatment, the more your costs are going to increase. But if something is prevented early, the prognosis of that treatment okuwonako kubeera kwangu than okulwawo. Biwolwawo okuwonako kujja kulwawo, naye wona ayanguwa ojja funa okuwonana kwa bwangu ate naawe obeere bulungi. So tetubeereeyo ng'olowooza nze ndi bulungi, amannyo tegannuma, ndya buli kyenjagadde. Nedda, osobola okuba n'obuzibu obutonotono ate okukebera ebiseera ebisinga si kwa bbeeyi. Omanyi abantu tebaagala kujja nti n'abasawo bajja kunsala ssente, akukebera si kwa bbeeyi. Ojja ne bakebera n'omanya obuzibu buli bwe buti ne bwe buti n'okitereera. So ekyo kyenyinza okulikomendinga abantu. Then ekintu ekirala kyenyinza okukoonako ekisemberayo ddala, abantu kwejjamu bintu mpulidde kino eno kikola bwe kiti, kino we bankola lutukana njawulira obulumi, kino we bankola kino nja kubeera bwe kiti. Ngaawo n'agenda mu ddwaliro ne bakujjanjaba omusujja, era kyekimu ogenda ku ddwaliro ly'amannyo bajja kujjanjaba obulwadde bw'amannyo bw'olina. So ekyo.
Thank you so much, Doctor, for coming. I've learned so much from you. I guess our dear viewers have learned so many things, and I myself have learned so many things that I even didn't know. So thank you so much, our dear viewers. My name is Agatha, the host, Empower the Girl Child. We are on TikTok and YouTube. Like, share, and comment. Bye bye. See you next time.